As we come to you tonight, Moderna and Pfizer's COVID-19 vaccinations are racing towards FDA review. This is all setting scientific speed records.
But we're asking how, where, and when those vaccines will show up in Missouri and Illinois. News 4's Alexis Zotos is in the Central West End learning CVS is bulking up big time in St. Louis, ready to immunize. Alexis?
Well, that's right. The big news here is that according to the federal government, the vaccine could be available in a matter of weeks to those high priority individuals like healthcare workers. And then more widespread distribution would follow after that. I spent today going over the 105 pages of Missouri's distribution plan for the vaccine. Pharmacies are going to play a role, and CVS tells me that they are working with the federal government to be an official distributor and provider of the COVID-19 vaccine, and they're hiring thousands to prepare.
Healthcare workers will be among the first to receive the COVID-19 vaccine. Good news as hospital workers cope with record number of patients.
Numbers are spiking. There is some, hopeful vaccines on the way. It sounds like healthcare workers may be on some of the first to receive that, so I think we're all pretty hopeful about that.
Missouri estimates there are around 425,000 healthcare workers to vaccinate. Next will be those at an increased risk for COVID-19, including those 65 and older. That's more than 2.3 million Missourians, if they all choose to get the vaccine.
There's going to be a large amount of work that's going to have to go on with messaging about the safety and how effective of a vaccine it's going to be, and particularly in populations that are traditionally skeptical of medical care.
Missouri has 105 pages detailing how they will distribute the vaccine, including through pharmacies like CVS. Nationwide, the pharmacy chain is hiring thousands to help with flu and eventually COVID vaccine support. A search for CVS jobs on LinkedIn shows CVS with more than 200 job postings in just the St. Louis metro. Many are for pharmacists and technicians who can help administer the vaccine. One complex part of this distribution is the second dose required 3 weeks after the first. Missouri will utilize its Show Me Vac system. That is a confidential database already used to track vaccines for schools and child care facilities. The federal government says the vaccine could be here in time for Christmas. The amount each state will receive is still up in the air.
Most of that will be reserved for those healthcare workers to get immunized. And so just to put that into a little bit of perspective, though, it's still a 2-dose regimen. And that's separated by 3 weeks. And so whatever allotment you get, you have to divide it by 2.
So there is going to be a massive campaign to really help educate the public about the effectiveness of the vaccine and what people need to know to get it. And of course, KMOV is going to be staying on top of it. You can find more details about Missouri's plan on our website, KMOV.com. Sam?
Alexis, St. Louis playing a big role in those vaccine trials with hundreds participating to get those vaccines to this point. Alexis, live for us in the Central West End tonight. Thank you.
And once the vaccine is released, initial availability will be determined by the governors of each state. That's confirmed by Health and Human Services Secretary Alex Azar. Illinois' governor says they've formulated a priority list already.
Some of the prioritization we've talked about, healthcare workers, long-term care facilities, residents of long-term care facilities, as well as staff. Certainly teachers are very important, but I also want to make sure that as individuals, those adults who are most vulnerable as individuals get it, early.
And you just heard Alexis. She alluded to Missouri's vaccine availability plan. Here's a full look at how people will be prioritized. It includes 3 phases, starting with healthcare workers, essential workers, and high-risk populations. Residents across the state would then follow.